Welcome to Larwin Square Dentistry. Inlays and onlays are lab-made restorations that are placed on teeth when the cavity or lost tooth structure is too large to be restored by a simple filling. The process of making an inlay is very similar to a crown. After the tooth is prepared, it is cemented or bonded to the tooth. A conventional filling does not solidify the tooth. It only fills the cavity in which it is placed. As time goes by, it might expand, increasing the risk dental fracture, or even contract, increasing the possibility of decay and reducing considerably the strength of the remaining natural structures. The condensation present in a mouth when inserting the filling material is one of the factors of contamination responsible for modification in the size. The bigger the restoration, the more the filling will be affected. If, by mishap, the tooth is fractured below the gum, the tooth must either be extracted or, if the fracture is not too deep, a step will be added to the treatment. There are different materials that inlays are made of, including gold, porcelain, and composite resins. Porcelain and composite inlays and onlays are cosmetic alternatives to fillings and are very strong compared to regular white fillings. Gold inlays and onlays are also suitable alternatives, but their appearance makes them less popular. We shall then proceed to the lengthening of the clinical crown. This is why it's important that your dentist see to it that all your fillings be faultless. Before it is too late, it would be crucial to think of a long-term solution. For all teeth presenting a faulty restoration, your dentist can advise you of the most appropriate solution. Contrary to the restorations done in the clinic, the inlay or onlay is manufactured in a laboratory as a model from impressions of the trimmed tooth. No contamination or condensation is possible. Therefore, instead of weakening the natural wall remaining, the inlay or onlay will contribute to its reinforcement. 2 to 3 appointments will be necessary for the complete procedure. First, the dentist will grind down the tooth, making sure no trace of decay or former filling is left. Then he or she will take a very precise impression of the trimmed tooth and will send it to the lab, where they will proceed to the making of the inlay or onlay. It is possible to have a choice of the material used for the fabrication of the inlay or onlay. It may be porcelain, resin or gold. You may discuss your choice with your dentist before the impression is sent to the laboratory. While the inlay or onlay is being prepared in the lab, a temporary filling will be put in. On the last visit, the temporary filling will be replaced by the inlay or, if the restoration includes a cuspid by an onlay, it will be cemented in place and an adjustment will be made if necessary. This simple technique allows 90% of the original strength of your tooth to be recovered. In addition, it is aesthetic. As far as cost is concerned, because the process of making an inlay or onlay is similar to a crown, its cost is also comparable. But when considering the longevity of inlays and onlays, they can end up costing less than traditional fillings. If you have any questions about inlays and onlays and you live in Tustin or surrounding area, give us a call today.